Hey everyone, welcome to this explainer. Today, we're unpacking a massive, kind of mind-boggling topic, the organizational structure of U.S. healthcare. We're going to look at the actual architecture of medical care in the States to understand a totally fascinating contradiction. Think about it. Why does a system that routinely cures incredibly rare diseases often completely drop the ball on basic care coordination?
All right, let's dive right into this paradox. Because it really is a tale of two extremes, right? We always hear about the technological miracles of modern medicine, stuff that sounds straight out of sci-fi. But, we also hear these deeply frustrating stories of fragmentation. Just think about your own experience. Have you ever felt totally lost just trying to get a simple referral? Or had to repeat your entire medical history to like 5 different doctors in the same building? It makes you wonder, how can the exact same system that performs literal surgical miracles completely fail to manage an everyday chronic illness?
To really wrap our heads around this, let's look at 2 real patient stories from our source material. On one hand, we've got Frank Hope. Back in 1989, Frank developed AIDS. For years, he was just in and out of hospitals. But then, by 1995, thanks to the discovery of life-saving protease inhibitors, Frank got this cutting-edge rescue care that essentially saved his life. I mean, he experienced the absolute best of U.S. biomedical innovation. But then, there's 3-year-old Ruby. Ruby's mom, who worked full-time as a bus driver, really struggled to navigate all these different urgent care clinics whenever Ruby's asthma flared up. They never saw the same doctor twice. And because absolutely no single clinic was taking the reins, coordinating her preventive care, or even tracking her meds, little Ruby ended up with a severe asthma flare-up and had to be put on a respirator in the pediatric ICU. The kicker here? Ruby's crisis wasn't a failure of medical knowledge. No, it was a complete organizational failure. Okay, part 1, pyramids versus diamonds, the actual anatomy of healthcare. So to understand why this fragmentation happens, we've got to look at how medical care is actually categorized globally and how the US kind of goes its own way. The blueprint for this goes way back to the super influential 1920 Dawson Report. It basically sliced medical care into 3 distinct tiers based on what patients actually need. First up, you have primary care. This handles the common stuff, sore throats, managing diabetes, getting your vaccines. Believe it or not, this tier accounts for 80 to 90% of all doctor visits. Then you step up to secondary care, which needs more specialized clinical expertise. Think a hospital stay for acute kidney failure. And finally, sitting at the very top is tertiary care. This is the super rare, highly complex stuff, like treating pituitary tumors or severe trauma. Now, different countries build completely different structures out of these 3 tiers. Take the UK, for example. They use a really structured, regionalized model. It's basically shaped like a pyramid. General practitioners form this massive, wide base, and they act as gatekeepers. You literally have to see them first before you can step up to a specialist. But the US? The US uses a dispersed model. It's more like a diamond, top-heavy and totally free-flowing. If you have insurance in the US, you're probably used to just booking a specialist yourself, right? So instead of a massive base of primary care doctors and a tiny little peak of super specialized hospitals, the US has this incredibly swollen midsection of hospitals all battling it out to offer the absolute latest cutting-edge tertiary services. Moving on to part 2, let's zoom in on that primary care base. Because honestly, when you look at actual everyday human populations, the need for medical care isn't shaped like a diamond at all. This graphic brilliantly illustrates what we call the ecology of medical care. It shows the monthly prevalence of illness in a community. Check this out. Out of 1,000 adults in any given month, about 250 will actually go see a doctor. But look at that tiny little box down in the bottom right corner. Less than 1 person out of 1,000 actually needs an academic tertiary medical center. That's wild, right? The vast, overwhelming majority of what we need is just minor ailment treatment, chronic care, and prevention. And yet our whole system is massively weighted toward that tiny little box. So what does a solid functional foundation actually look like? Well, according to the foremost primary care scholar, Barbara Starfield, true primary care has to nail 4 essential tasks to actually work. 1, it's gotta be your first contact when a symptom pops up. 2, continuity. It has to build and sustain a real relationship with you over time. 3, comprehensiveness. It needs to manage a wide range of needs, not just focus on, say, your left elbow. And 4, coordination. It literally has to coordinate all your other specialist care. And the data here is crystal clear. Studies consistently prove that when a system hits these 4 marks, patients get better outcomes, they're way happier, and the costs drop significantly. And you can see the sheer power of this coordination in real patients, like Polly Seymour. So Polly was seeing everyone, a dermatologist, a gastroenterologist, an orthopedist, an oncologist, the whole shebang. She suddenly developed this severe nausea and vomiting. She spent $3,000 on CT scans and endoscopies with her specialist trying to find the cause, and they found absolutely nothing. Zero. Finally, she goes to a primary care nurse practitioner. By taking a step back and looking comprehensively at Polly's entire chart, the nurse practitioner spotted the problem right away. Polly was taking two conflicting medications prescribed by two totally different specialists. The nurse practitioner simply adjusted the meds, and boom, the nausea vanished. She acted as a true care coordinator, treating the whole person instead of just playing whack-a-mole with an isolated symptom. Which brings us to Section 3, the forces shaping U.S. healthcare. Okay, so if primary care is absolutely crucial for better outcomes and saving money, how on earth did the U.S. system get so top-heavy, hyper-specialized, and fragmented? Well, that dispersed, diamond-shaped model didn't just appear out of nowhere. It was forged by three massive historical forces. First, there's the biomedical model. This kicked off in the early 20th century and basically trained doctors to hunt for highly specific, scientific causes of disease, looking for magic bullets for specific organs. Naturally, that pushes people toward intense specialization. Second, medical professionalism. Unlike a lot of other countries where the government stepped in to strictly regulate hospital planning, the U.S. essentially handed doctors the keys, giving them huge autonomy to build the system themselves. And third, and let's be real, probably the biggest driver, financial incentives. Now, this number is a real eye-opener. The financial reality here is just stark. As insurance companies started paying way more for flashy new technological procedures compared to just, talking to a patient in an office, a gigantic income gap exploded. Get this, by 2006, primary care providers in the U.S. were earning literally half as much as specialists, 50%. This economic reality basically funneled generations of medical students right away from general practice and straight into specialized fields. And that is exactly how we ended up with the specialist-heavy system we're navigating today. All right, Section 4, the drive toward integration. So the people running the system finally recognized the insanely high costs, the totally lacking coordination, and just the sheer chaos of this fragmented cottage industry approach of solo doctors. And because of that, the U.S. health system is currently undergoing a massive evolution. We are seeing a huge shift toward organizational integration, and one major way they're doing this is through vertical integration. Basically, imagine cramming everything under one giant organizational roof. Kaiser Permanente is a perfect example of this. In a vertically integrated system, your health insurance plan, your hospitals, and your doctors all work for the exact same corporation. So if you hit up the urgent care clinic on a Saturday, your records are instantly right there on the screen for your primary doctor on Monday because they all use the same system. It's a total game changer, shifting care from a fragmented mess into a highly streamlined machine. But look, not every doctor actually wants to be a corporate employee, right? And not every patient wants to be locked into just one hospital system. Enter solution number 2, virtual integration. This model is super clever. It weaves together independent doctors in their own private offices and autonomous hospitals using managed care contracts rather than just buying them all outright. Things like independent practice associations and network HMOs use these airtight contracts to mimic the coordination and the cost control of a vertically integrated system, but without forcing everyone to wear the same corporate badge. It's basically a massive virtual group practice. So here's the absolute biggest takeaway from all of this. Whether it's happening through independent practice networks, regional hospitals buying up your local mom-and-pop clinics, or these massive corporate groups, the era of the solo doctor, just hanging a shingle and operating entirely on their own, is fading fast. The whole future of healthcare delivery is sprinting toward these larger, heavily interconnected organizations, all mapped out across varying degrees of integration. And as we watch this monumental shift, literally transforming a cottage industry into a web of multi-billion-dollar integrated health systems, we really have to stop and ask ourselves one critical question. Is this highly integrated future actually going to fix the fragmentation of your medical care? Will it finally coordinate your treatments and prevent totally avoidable tragedies like young Ruby's asthma attack? Or, as these massive systems gain more and more market power, are they just going to prioritize their profits and the bottom line over you, the patient? Truly, it is the defining healthcare question of our time.